It's now my pleasure to recognize the member, Ms. Walorski, for her inquiry.
Thanks again, Mr. Chairman. I'd like to submit for the record a March 2020 report from the National Center on Early Childhood Quality titled Addressing the Decreasing Number of Family Child Care Providers in the United States.
Without objection.
Thank you again to all of our witnesses for sharing your experiences here today. I have a couple of questions for Secretary Sullivan. In your testimony, you said Indiana deemed child care an essential service and was able to keep some providers open to serve essential workers. Did the state receive any waivers or additional flexibility from the administration or HHS to help make sure providers could still operate?
Thank you for the question. We have been so lucky with the flexibility that comes with the child care block grant and utilized all of those flexibilities to make sure that we were able to allow children to continue to access child care services. As you heard early in my testimony, we went virtual very early as an agency and made sure that there was ongoing eligibility assessment that was uninterrupted despite the response. We created an additional priority status for essential workers. Our current 3 priority statuses pre-pandemic were in partnership with our Department of Child Services for foster families, for caregivers that participate in the program, and for caregivers that participate in the SNAP program. And so this created another eligibility category that allowed those essential workers to access and immediately enter CCDF. We also granted a great degree of flexibility for families to take increased personal days so that if they weren't actively working, they would still be able to keep their vouchers so that when they did go back to work, they wouldn't have a gap in services. Additionally, we didn't ask families, we asked child care providers to be eligible for our temporary assistance grants to not charge families to hold spots. So that was a pre-existing requirement to be eligible for the grant so that families wouldn't have to pay for child care that they weren't using and having an additional financial burden on those families.
So every family is unique, so it's important to make sure we preserve different child care options for parents. Can you comment on how the state has worked to include family child care in quality improvement initiatives and other efforts to support access for families?
This is a really interesting question. We know nationally that the number of family child cares are dropping, and in some states, it's actually dropped by as much as 20% over the last 5 years. We've been asked to look at this on multiple occasions, and in Indiana, that actually is not the case. We continue to see a stable number of child care homes as part of the services that are provided in Indiana. And we, one of the conclusions that we've drawn from that is that we don't include, many states don't include family homes in their quality rating and improvement system, and also don't allow them to participate in their pre-K programs. And don't fund them the same as they would for a center. We do. So we include our child care network in its sum total. We include them as they're able to participate in our On My Way pre-K program and also are part of our Paths to Quality initiative. So they can be designated on that level of high quality child cares and be ranked in that space. And so we think that we have a best practice here to make sure, again, that we really support a network. We have a long way to go, but we've made really substantial progress over the last 5 years of enhancing those services and providing development and technical assistance for the entire spectrum of providers.
And then finally, what can we do at the federal level to support and grow family child care providers so they're both high quality early learning settings for children and they're sustainable businesses as well? What's the best thing we could do to help?
We need to start thinking about child care the way that we think about any sustainable network. This has to be something that can last for more than 2 weeks at a time. One of our biggest points of learning is that the assistance that we need to develop this as not just a safe place for kids to go, but a place for them to learn and to be healthy and then to be a business is really our goal. And so establishing childcare as not daycare, but really early childhood education and the maturity that comes along with a networked system that has sustainable funding, that's flexible, that can respond to pandemics and not just natural disasters, is really really a short-term goal. It shouldn't be in the distant future for us.
I so much appreciate your testimony. Thanks so much, Mr. Chairman. I yield back. Thank you.
Thank you, Representative Walorski. And now it's my